then then we are now ready to go to our music presentation, man, which is going to be about the tracers. Fantastic. Can't wait to do that. Okay, Tracers by Li Mingxi.
Yes.
Should I change the slide or no? It's fine.
It's fine. It's fine. Okay.
Okay. You want to talk
So,
first? Yeah.
so good morning, guys. So the content, that I'm going to talk about today is the tracers, and the tracers in the PET scan for the Alzheimer's disease. Next, please.
Oh, fantastic.
Uh, at the beginning, I'd like to talk about its definition. So tracer is a maker that used to observe, study, or measure the behavior or nature of a substance in a specific process. As a tracer, its nature of behavior should be exactly the same or little different from that of agent in the process. The amount added should be small and not have a significant impact on the system. In addition, the tracer must be easy to detect. The common tracers are like the isotopic tracer, enzyme tracer, enzyme labeled tracer, fluorescent labeled tracer. And there are radioactive isotope tracer, stable isotope tracer, and non-isotope tracer in the isotopic tracer. Okay, next please. And and then the tracers refers to a list of types. Histochemical tracer, it is a substance used for tracing purpose in histochemistry. The study of the composition of cells and tissues.
Mhm.
And isotopic tracer, it is a substance with an isotope that has been enriched to a greater level that found in nature. Uh, uh, and then radioactive tracer. It is a substance containing a radioisotope that is used for tracking purpose. Fluorescent tracer. It is a substance such as 2-MbDg containing a fluorophore that is used for tracking purpose. Also, the cosmic ray detector, transition radiation array for cosmic energetic radiation. And the last one is flow tracer. It is used to track fluid motion with any fluid property.
Interesting. And just makes it one quick question.
Yeah.
I honestly, in the past, I never saw this broad classification of the tracers, and I'm really pleased to see that we have, I should say, more than six broad branches of the tracers. And we have, I knew about, for example, radioactive and fluorescent tracers, but I never noticed the difference between isotopic tracers and the radioactive tracers. Do you know the difference between them? Because it seems that both should come from the same nature, or maybe I'm wrong.
The isotope tracer is a substance with an isotope that has been enriched to a greater level that found in nature.
Uh-huh.
Uh, oh wait.
It
Uh,
can be the same like the radioactive tracers, or
the radioactive tracer contains a radioisotope that is used for tracking purpose.
uh-huh. Okay, okay. And
Okay.
for the case that you have, for example, for the PET scans, which is used to in advance give a warning for the Alzheimer, which tracers do they use?
Radioactive tracer.
They use radioactive tracers.
Yeah,
Interesting,
yeah.
interesting. Nice, very nice.
Okay, next please.
Yeah, sure.
I will mainly talk about the radioactive tracer. Uh, so radioactive tracer is a chemical compound in which one or more items have been replaced by a radionuclide So by virtue of its radioactive decay, it can be used to explore the mechanism of chemical reactions by tracing the path that the radioisotope follows from reactants to products. And by the way, radioactive tracers can form the basis of a variety of imaging systems, such as the PET scans.
That's right. And
And
that's
yeah.
very good because the purpose of that work which you are doing, I should say, Mingxi, for the presentation and for the whole class, is that we see that, for example, when we talk in advanced functions class, grade 12, about a very interesting mathematical model, which it was exponential decay. And we talked about, for example, radioactive decay, which follows that mathematical model rigorously. We see that, for example, it can be extended to applications like that, for example, as a radioactive tracer, which it's, as you will explain further in the next slides, it can be used to detect Alzheimer of the persons who reaches to an elderly age then. That's brilliant, man, brilliant. Next slide.
Yes. And what is a radioactive tracer used for? As we talked before, it is used to form the basis of imaging systems, such as the PET scans and imaging tests that help find problems inside the body. These tracers give off particles that can be detected and turned into a picture to help find the problems in organs or other structures. Uh, and it is usually given through an intravenous line placed in a vein. Uh, by the way, also the tracer also may be given by mouth or by inhaling it into the lungs. The tracer then travels through the body and may collect in a certain organ or area, and it uses positron emission tomography and nuclear medicine scans to look at specific organs such as the liver, lungs, kidneys, and gallbladder.
Okay.
Okay.
Mingzhe, do you have any
Yeah.
slides in the coming slides talking about how the PET scan works, positron emission?
Uh, yes. Yes.
Yeah, you have. Okay.
Yeah.
Next slide.
Yeah.
Sure. Oh, I cannot go to. Oh, there it is.
Uh, and then I will talk about the Alzheimer's disease. Alzheimer's disease, we can simply call it AD. AD is the most common and fastest growing cause of dementia, accounting for an estimated 60 to 80% of all cases. Irreversible and progressive. AD slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks of daily living. Although treatment can help manage the symptoms of AD, but there is no cure for the disease. According to Alzheimer's Association, the progression of Alzheimer's disease is called the Alzheimer's disease continuum. On this continuum, there are three broad phases, which are preclinical Alzheimer's disease, mild cognitive impairment due to Alzheimer's disease, and dementia due to Alzheimer's disease. Okay, next, please.
Fantastic. I did know that. I didn't know that there are three phases. We have preclinical, then the dementia becomes mild, then it becomes dementia completely. Then interesting. Thanks.
Yeah. So what caused the AD? The hallmark changes of AD are the accumulation of the protein beta amyloid outside neurons and the accumulation of an abnormal form of a protein inside neurons. Plaques and tangles may make healthy neurons in the brain work less efficiently and eventually die. And neurons in the hippocampus, the brain's learning and memory center, are among the first to be damaged and die. Neuronal damage eventually separates to other parts of the brain, causing it to shrink with the loss of neurons. And by the way, scientists believe the brain changes of AD begins 20 years or more before the clinical symptoms appear.
Oh, interesting.
So the clinical symptoms usually begins to appear 20 years before.
20 years before. And just the Mingzhe, one question and one comment I have to make about the type of a protein which you talked about, that it's beta amyloid. And also there is another protein which is called tau protein, which both of them, it's responsible for, I should say, for the Alzheimer. I want to make a quick comment here before you go to the next slide, which relates
Yes.
also to the thing which I said to Sean. Sean, are you here?
Yes.
Yeah, listen to this part. Are you listening?
Yes.
Yeah, and how about Arya and Dark Knight?
Yes.
Yes, awesome. Look at that. For example, Mingzhe is talking about a very interesting point here, that there is a protein which is called the tau protein and beta amyloid protein, which they are mostly responsible for the Alzheimer's disease. But look at that. Based on the thing that Sean also talked, that he talked about the proteins, guys, there is the how math can help here. For example, you are doing the advanced function class, and you may wonder, why do you have to talk about the neuroscience and clinical neuroscience and neurology and the Alzheimer, and how it works? For example, with the protein, which is beta amyloid, and the tau protein, these proteins, imagine that, for example, they are, imagine the ruler which you have. A ruler is straight, huh? Is a straight. A ruler which you have is straight. The protein, when they get synthesized, yes, Mingzhe, like
Yes.
beta amyloid, or for example, tau protein, which they cause the Alzheimer, they are in a straight format. For example, in the ribosome of the cell, the mRNA, the messenger RNA, has the prescriptions for the protein to be synthesized. The protein is a straight line, and like the ruler which you have. In order that they function, they have to just take a three-dimensional shape. For example, imagine you break your ruler in three different shapes, and it becomes the form of the protein which carries a function inside your body. Each format, the protein which it takes, it dictates, its structure dictates the function which it does. But now here's my point for everyone here with the advanced function class. With the beta amyloid and tau protein that they cause the Alzheimer, they call that misfolded. Imagine that if you, for example, if you have a piece of paper, you crunch your piece of paper and it takes a form, and it becomes responsible for one type of the function. For these two proteins, the folding which they get is not normal. The folding is different. Imagine that if you, for example, fold it from left to right, they become folded from right to left. And that's why it causes the Alzheimer. This is called misfolding of the protein. However, what's the connection of that to the advanced function class? And it's this. For those of you who are interested, you can use the math, and essentially that's what they done. And they call that computational neuroscience. And what do? They use the advanced mathematics. And also they use something in computer science which is called machine learning. They combine very advanced mathematics with machine learning in order to predict the way which the beta amyloid and tau protein, which they causes Alzheimer, that they get misfolded. You see, it's many compositions that you can think of, and the mathematics and the computer science, it gives a prediction that what type of misfolding causes the Alzheimer. You see how important is the math? Yes, everyone?
Yes.
Yeah?
Yes.
You see
Yes.
that the math that you are learning can contribute to make a prediction that what kind of misfolding of these two types of proteins, which is tau and beta amyloid, leads to the Alzheimer. I'm so impressed by the math myself that you see that this is not just in the classroom, it goes to detecting the cancer, to make a prediction of why the Alzheimer may shows up, and I'm so I'm my mind is blown. I don't know what to say. I'm so excited. Yes, please, Mingxi, go on.
Okay.
Next slide.
Yes, next slide. And then the PET, which is positron emission tomography. We can simply call it PET. So it is an imaging test that helps review how people's tissues and organs are functioning. A PET scan uses a radioactive drug to show this activity. It produces a 3D image of functional processes in the body, and a PET scan uses a small amount of radioactive tracer uses a small amount of radioactive tracer to show differences between healthy tissues and diseased tissue. It is useful in reviewing or evaluating several conditions, including many cancers, such as the heart disease and brain disorders. Often, PET images are combined with CT or MRI scans to create special views. And this scan can sometimes detect disease before it shows up on their imaging tests. Okay, next, please.
Sure.
And then, so how does the PET scan treat the Alzheimer's disease? The special PET scans use radioactive tracers to highlight amyloid protein plaques in the brain, which are a hallmark of AD. They may allow doctors to diagnose Alzheimer's earlier, even before any symptoms appear. But many people with amyloid plaques in their brain don't have Alzheimer's disease. That's unfortunately. The tracers makes it possible to image the effects of chronic administration of an inhibitor for an enzyme called beta-site amyloid precursor protein cleaving and enzyme, which cuts off protein fragments that can lead to amyloid beta development and is more prevalent in brains affected by Alzheimer's.
Interesting. But I
Yes.
mean that you do not mean that the PET scans treat the Alzheimer. You mean that the PET scans helps us to diagnose the Alzheimer, huh?
Yes.
Oh, yeah. Awesome. Fantastic, fantastic. Next slide.
Yes.
Okay.
So what is beta amyloid and how is it implicated in Alzheimer's disease? Beta amyloid protein plaques in the brain are one of the defining features of Alzheimer's disease. However, we also know the effects of beta amyloid on a person's brain and cognitive abilities are not straightforward. For example, research has been shown that up to a third of older people without cognitive problems also have beta amyloid accumulation in their brains, and beta amyloid can be present for years before symptoms of dementia can become apparent. Okay, next please.
Interesting. Beta amyloid can even be on the brain, accumulated even before the symptoms shows up.
Yes.
Okay, interesting.
So how a brain PET scan is performed? So the first point is a special dye with radioactive tracers will be injected into your veins through this intravenous. And then the patient need to take time for the body to absorb the tracers as blood flows through the brain. And the patient need to lie on the PET scanning machine and be ready to scan. And while scanning, the patient is necessary to stay calm and silent. After scanning, it will record brain activity as it's happening. This can be recorded as video or as still images. The tracers are concentrated in areas of increased blood flow. And the last one is when the desired images are stored in the computer, patient will exit the machines and the test is done.
Interesting. I think that the tracers which they use, it's a kind of a glucose, a chemical glucose, which if it
Yes.
does a tracer, then at the part of the brain which how it works, it provides a kind. I think the way it works is that, Mingxi, correct me if I'm wrong. It's the rate tracers which they use. It's a kind of a glucose, which is a kind of is a radioactive glucose that when it's inside the vein, it goes through the flow of the blood, goes to the brain,
Yes.
and it part of the brain. The PET scans provides a contrast image. I wish if you had some pictures to show the PET scans itself, then it was very helpful when I'm talking about that. Do you have any pictures of the PET scans itself?
No, but the tracers, after injected, it flows to the brain as the blood flows.
That's right.
And the scanning machine will detect if there's some damaged tissues in the brain with by looking up the beta amyloid protein.
That's so true. And
Yeah.
also, if you had one picture slides of how a brain looks like after you just, for example, the brain image from a PET scans, it shows how it works. For example, the glucose, that it was a kind of a radioactive tracers that the patient takes, because of the blood flow, it rushes towards the brain. And part of the brain, which they are more active, they need more energy, then they intake more glucose. And the
Yes.
part of the brain which they are less active, or maybe they have been damaged because of, let's say, for example, the presence of the amyloid beta or tau protein, they are less active, they are dead. Then it means that they
Yes.
do not take the glucose, because when that cell is dead, then they do not to feed on the glucose. Then
Yes.
what the PET scan does is that those glucose, which they are radioactive tracers, they interact with the PET scans. They have, for example, the positron emitted and the electron emitted, and they, let's say they collide, that's more quantum physics involved, then they create a radiation because of the collisions which they have, and the PET scans detect that collision from radiation of the brain. There are lots of computation happening there, but at the end, what happens? The brain shows a contrast pictures of the area of the brain which they didn't use the glucose, and the area of the brain which they use the glucose. That a
Yes.
doctor, by looking at that picture, says, okay, that part of the brain which they didn't use the glucose, they are the area which it means that they are less active. And that's the sign that they are leading to the dementia and they have been impacted, let's say, by those amyloid beta or tau protein then. Am I right?
Yes. Yeah, you are so true.
Awesome. That was a great slide. Thanks. Next one.
Yes, next one. The last one.
Yeah.
So I listed several advantages of the PET scans for the brain. So it allows metabolic activity to be directly visualized but not inferred. And PET studies allow abnormal brain function to be detected before structural changes resulting from brain cell death can be seen on CT or MRI. And it is highly useful in detecting specific types of dementia, such as Alzheimer's disease and frontotemporal dementia. In these disorders, early brain damage may not impact brain volume or structure that is identifiable on CT or MR. So PET scan can accurately detect the abnormal brain tissue in time so that the patients can make the appropriate treatment in time to prevent the deterioration of the disease appear. It is a pretty effective therapy for treating Alzheimer's disease. Okay.
Interesting. I'm writing one note here. You talked about frontotemporal dementia. I knew about that. It seems that I have totally forgotten. It's a kind of a dementia, but I have to search myself what was similarity between the Alzheimer's disease and frontotemporal dementia. Do you know that, Mingxi? Or I don't expect you to know that because I don't know that myself.
I just know it's a type of dementia, but I don't know it too specifically.
Oh, no worries. I don't expect you to know that because I myself, I have forgotten completely about that. But that's totally fine. I'm gonna when after the 2-day session, I'm just gonna go back to search it online to see what was it. But that's so true. These disorders, early brain damages may not impact brain volume structure that is identifiable. That's a very interesting conclusion that the PET scans can detect dementia even way before that the structural changes of the brain can be identified using MRI scans or the CT scan. Oh, interesting. I never thought of that myself. Oh, fantastic,
Okay.
fantastic. Next slide.
I'm done actually.
Oh my God, thanks, Mingxi.
Thank you, thank you. Oh my God.
Great presentation. I wish if you had some scans of the PET scans that it shows the brain that it has been detected by the PET scans, but that's totally fine. And the fact that you talked about the metabolic activity to be visualized as a contrast, it's more than enough. Fantastic.
I'm sorry, I forgot to put the pictures.
No worries. You didn't have enough time. No worries. That's totally fine.
Okay.
But the metabolic activity that you talked on the first line, it's more than enough. And I should say, I missed the days when I was doing the research on those kind of stuff with the Alzheimer in the neuroscience. And I missed the time which I was doing that. And you brought me kind of good memory. Thanks, Mingxi. Thanks.
Thank you, thank
Great
you.
things. And Mingxi, the good thing was that we see even the math can take us even to do some high field research in the computational neuroscience and the clinical neurology in order to make a prediction about how a misfolded protein can just lead to the Alzheimer. And not a clinician, not a doctor can they do that. Only this is done by mathematicians and the computer scientists, which it was the purpose of your presentation to call to everyone, guys, take the math seriously because you can contribute significantly, not even to the cancer, for example, but also to the neuroscience, the neurology, and for example, treating the Alzheimer's disease then. Fantastic. I'm so impressed. Thank you very much, Mingxi. Thanks a lot.
Thank you so
Much
much.
appreciated for your hard work on that presentation. Thank you.
Thank you.
Thank you. Thanks. Okay. I'm gonna